It was a chilly day in March of 2010. I woke up that morning feeling like I had the flu bug. I was working as a cook at Bitter Creek Ale House and decided the best thing to do would be to call in for the day. I climbed back in bed and tried to sleep it off for the next few hours. When I awoke, I still felt weird. Something wasn't right. I called my boyfriend and asked him to pick me up a pregnancy test on his way home. When he arrived at home, I met him at the door and sprinted to the bathroom. The pregnancy test said wait 3 minutes for results. That wasn't the case for me. Results were instant. I was having a baby. My morning flu bug turned into a 9-month-long flu bug, and from the minute I found out I was pregnant, it wasn't a question in my mind. I was breastfeeding my son and will continue to do so until I feel he is ready for regular milk. Breastfeeding starts with an incredible bond between mother and child and has many benefits in the first 6 months. Today, I will persuade you why breastfeeding is better than formula feeding. I will show you how breastfeeding is more beneficial than formula feeding, and I will give you some good facts that you can use to persuade others why breastfeeding is more beneficial. I personally have been breastfeeding for almost 8 months, and I have read books on breastfeeding, I have heard other mothers' experiences, and I have researched websites on breastfeeding. Today I'm going to talk about the complications that may happen in the first few days, the health benefits that arise from breastfeeding, and the benefits of breastfeeding in the first 6 months. According to the Center of Disease Control Breastfeeding Report Card of 2010, of the 75% of women who start out breastfeeding in the hospital, at 3 months, only 40% of them are exclusively breastfeeding, and at 6 months, a mere 17% are still breastfeeding. And that means, of the 5 of us in this room, 3.75 of us will start out breastfeeding, and by 6 months, only 1 of us will continue to do so. I have 4 other friends, and we all had babies within a couple months of each other. And out of the 5 of us, 2 of us breastfed, and I'm the only one currently breastfeeding now. But lucky for me, it was smooth sailing. My son came out ready to eat, and he hasn't stopped since. I never had a problem with him not latching on, or my milk not coming in. But for many other women, it's not as easy. There are many complications that can arise in the first few days. If you are a woman with inverted nipples, then you're going to have a problem with your baby latching on. You're probably going to have to use what is called a nipple shield, and it's going to take time for the baby to learn how to latch onto this. This is going to cause frustration between you and your child, and it may take time for your milk to come in because your baby's not latching properly. You may also develop what is called mastis. Mastis is an infection in the breast caused by bacteria. The best thing for you to do is to keep breastfeeding your baby and push through it, and you'll be okay in no time. All of this may seem like reasons not to breastfeed, but they don't happen to all women, and they're just minor and temporary. And if you push through it, then you're going to be okay. I have just talked about the complications that may occur with breastfeeding, and now I'm going to talk about the benefits of breastfeeding in the first 6 months. When you have a child, you want to provide them with the best possible nutrition available. Breast milk is the most nutritious way for your child to get food for at least the first 6 months. It is proven when comparing breastfed babies to formula-fed babies in either low birth weight or preemies, even if you only add breast milk to a third of their diet, breastfed babies tend to go home 15 days earlier, as quoted in The Maternal Benefits of Breastfeeding, Last Access, July 18, 2011. Among some of the most common atopic diseases are respiratory infections, eczema, and food allergies. According to an article in the Lancelot, there was a study done on 150 children from the time they were infants until they were 17 years old. The children with the lowest amount of problems were the children that had been breastfed for at least 6 months and closer to a year. DHA and ARA are 2 major nutrients that children need to develop proper brain growth. DHA and ARA are very essential in an infant's first 6 months. DHA, which is a fatty acid, provides an important role in the infant's growth and brain development. These 2 nutrients are organically included in breast milk, and it wasn't until recently that they were synthetically able to put them into formula. Childhood obesity is another really controversial topic when it comes to breastfeeding. Many people believe that it has nothing to do with breastfeeding versus formula feeding, but recent studies are proving different. Breastfed babies and formula-fed babies receive different types of nutrients, and therefore their metabolisms run at different rates, and their little bodies will store nutrients and hormones such as insulin differently. And in that study, it went to show that at 12 months of age, breastfed babies were skinnier than formula-fed babies, as quoted in Breastfeeding Fights Obesity Last Access July 18, 2011. I have just talked about the health benefits of breastfeeding, and now I will talk about the first 6 months of breastfeeding. The first 6 months are the most crucial months to breastfeed. That is when your child is growing the most and developing the fastest, and developing all of the senses he or she will begin to use as a human being. In a story written by Heather Garvett, she claims that exclusively breastfeeding your infant through 6 months of age will lower the risk of suffering from ear infections and childhood cancers. I have to add that in the 7.5 months my son has been breastfeeding, we have not had one ear infection, one fever, or one cold. Even though the first 6 months are the most critical, the benefits will continue to help and become stronger the longer you breastfeed. Some women are even comfortable breastfeeding their children until the age of 2. I feel the pros really outweigh the cons when it comes to breastfeeding your child. Yes, you have to make sacrifices to yourself. Your child is going to be more dependent on you, and you're not going to be able to get very far for very long. But you made sacrifices to carry that child for 9 months, so what's a few more after that? I'm not trying to prove here that formula feeding is a bad thing, and that every child that grows up on formula is going to be obese or catch diseases. That's not the case. Many women are not able to breastfeed, and in that case, then formula is the most perfect nutritional choice for your child. I'm just trying to persuade you that if you do have the choice, fight through the small little obstacles you may face, because the benefits and outcome for your child are so much better. Today I have shown you the incredible bond that a mother and child grow, and also the many benefits that come with breastfeeding. We have been persuaded about overcoming the obstacles that come with breastfeeding in the first few days, the health benefits that come with breastfeeding, and breastfeeding in the first 6 months. I have only had one child, and I love the bond that we have created and the relationship we have because I chose to breastfeed him. Anything that is better and more beneficial for my baby is an easy decision for me to make. So for those of you who are expecting, or may be expecting in the future, I ask you today to talk to your healthcare provider about breastfeeding. Breastfeeding is a gift that lasts a lifetime. And remember, mommy's milk is better than any other milk.